the appointment, it's very important to have a written correspondence between your patient so that you can understand their needs, and if they have any questions, get them answered before they come in if possible. Some deaf patients or hearing impaired patients are good lip readers or speech readers, so it is important to always face them directly and never have your back turned to them or half turned to them. During the actual appointment, some barriers can occur, such as the face mask, which will block the lips and prevent lip reading to continue. So learning some basic American Sign Language can help you communicate with your patient. It is important to provide them with the knowledge that you know. So having a handout handy could be very vital to treatment. Difficulties in communication can occur once the mask goes on. So it's important to review a few signs of ASL with your patient to be able to make sure that you can communicate during treatment. These are just some of the signs that are important to have knowledge of during treatment. Performing OHI can have some very big barriers when you're working with a hearing impaired patient. So it's very important to have visual aids that you could give to them to be able to look at when they get home. Communication can be very difficult with these patients, so it is important to always have visual aids present to be able to show them maybe the proper brushing technique or things like that. It may also be very useful to have a pen and paper handy just in case all other communication does not work out. Next, we will review a few simple dental signs that are important to understand when you encounter a hearing impaired or deaf patient. In conclusion, it is always important to have a written correspondence between you and your patient prior to the appointment. This will allow for any necessary medical history updates or new medications to add to the chart. Special considerations for a patient with a hearing aid is to not have their head turned so far as to put pressure on their hearing aid onto the pillow. This can cause discomfort. Another tip is to have them turn off their hearing aid during ultrasonic scaling. Having a translator present can be very viable to the treatment of a deaf or hearing impaired person, but always remember to speak to the patient and not just the translator. Having visual aids is key to the success of OHI with a deaf patient. Always be sure to have brochures on hand and also be able to help the patient demonstrate on themselves for clear understanding. And lastly, always face your patient and speak in a normal, clear tone. When you raise your voice, this can cause distortion of your lips and cause lip reading to be increasingly difficult for your patient.